Okay, let's do the muscles of the head and muscles of the face. Everybody, anybody? Okay, frontalis, and what about here? Temporalis. Orbicularis oris. No, orbicularis. Oculi. Orbicularis oris. What about this? Zygomaticus. Okay, and this. Not mastoid process. Mastoid process of bone. This is masseter. Masseter. Yeah. Let's move on to the neck. Let's see what we can remember. What's this? Oh, that one you all know, huh? Origin. Origins. Sternum and the clavicle. Insertion. The mastoid process right there. Okay. Oops, sorry about that. Let's go to the back. Okay. See if you could identify anything. Let's see. How about this? Trapezius. Trapezius. Okay. How about this?
Levitator.
Scapula.
Yes, levator scapulae. Okay, levator scapulae. Okay. Action?
Shrug and shoulder.
Elevation.
Okay, elevation of the scapula. Clearly, the insertion is the scapula right here. Okay. What about this one?
Deltoid.
No, that's not a deltoid. This is the deltoid right here. They took out the deltoid so they can show us more muscles inside. We did this earlier in lecture. This is the spine of the scapula, so this is the that's right, supraspinatus, infraspinatus. The smaller one, the minor. That's right, teres minor. And all together, along with the subscapularis underneath, which we can see, they make up the, that's right, the rotator cuff muscle tendon. How about this?
Rhomboid minor and major.
Good. Rhomboid major, it's bigger. Rhomboid minor, smaller. Which one do you think is the origin and the insertion? This would be the origin. This is the insertion because it's the one that moves towards the origin. Okay. Let's move down. What else is here? Latissimus dorsi. Okay. Origin, right? All your spinous processes here. Part of your ilium right there. And it looks like it's inserting to the humerus. That's right. So meaning it crosses the shoulder joint, which means it will move the arm. No? Imagine your latissimus dorsi pulling your arm this way. So that action. Okay. What else is here? Did we miss anything? Okay. Deltoid. No? Earlier in lecture, we said that the deltoid is big. Do you see now what I meant by lateral fibers? Anterior fibers of the deltoid, and then posterior fibers of the deltoid. Okay? But if we just say deltoid, what would be the primary action of the deltoid? Abduction. So imagine this insertion moving towards this origin. So that would be abduction. Okay? But again, only voluntarily contracting this will do a specific action, and this one only will also do a different action. Okay, what's this? Lucid magnet. That's easy, right? Okay. Are we still filming?
Still going.
What is this? Pectoralis major, right? You could see the origins, right? You have an origin from the clavicle, you have an origin on the lateral side of your sternum, and they all insert also to the humerus. So the action would be, imagine your pectoralis pulling this way. That would be
Adduction.
adduction. Very good. Okay. Let's take out the pectoralis. What you will find would be the pectoralis minor, the smaller one. And then you could see here in between the ribs, you have your intercostal. What are your two intercostals?
External.
External and internal. Okay. rectus abdominis. Okay, this is not a good model for this, but we'll just say that the fibers are arranged this way. That's right, transversus abdominis. This one is a little better. Oblique. External or internal?
External.
External. Remember what I said about hands in the front pocket? This way. Okay. From the lecture earlier, what is this line right here? Very good. Linea alba. Okay. So let's move down. I only have this one model, but clearly we can use the other models we have here. Okay. What else do you want? Okay. How about we do this? A very intimidating arm right here. Okay. So once again, you have your supraspinatus, your infraspinatus, your teres minor, and your teres major, your deltoid. Okay. What's this? Biceps? Is that biceps? Is it?
Tricep.
That's posterior, so that is triceps. Okay. This is your biceps. Okay. So there's only a few in the arm. Remember, there's so many in the hand, but this is big, but you only really have triceps, biceps, but we also have this one. Do you know what this is? Brachialis, which helps the biceps in elbow flexion. Okay, that's the brachialis. And then we move down. You know, there are many muscles here, but we only selected a few. How about we start with the easy one? I think we started with the one with a long tendon going to the palm, the skin of your palm. Palm, and it's long. Palm, and then long. Palmaris longus, right? The one with the long tendon. Yeah, see, it's going to the palm. Okay, palmaris longus. And then during the lecture, we had that model that we labeled. This is the, it's more lateral. This is the brachioradialis. That's right. So you have to identify first if it's right and left, so you can identify if it's medial or lateral. So brachioradialis is in the list. And then we have a lot of muscles right here. Let's pick an easy one again. Underneath your palmaris longus, you have this muscle. It says number 20 right there. But if you trace the muscle all the way to the tendon, it's going to the digits. So this muscle, this tendon is of this muscle known as the digitorum. You're right. But what comes before digitorum? Flexor. Why? Because these are anterior muscles which flex the digits. Okay? If it were on the other side, right here, if you trace the muscle tendon going to the digits, it's also still digitorum, but it's, that's right, it's extensor digitorum. Okay. What else can we pick from here? Well, you can actually even be more specific. Like this tendon goes to the pinky, this tendon goes to the thumb, this tendon goes to the index finger. So you can have digiti minimi, indices for index finger, and pollicis for thumb. So you could have flexor, extensor, digiti minimi, flexor, extensor, abductor, hallucis. Okay, those last names of your muscles will just be a little bit more specific. Anything else we have here? So we also have here your flexor carpi radialis, because it's going to the radial side, which means on the other side is flexor carpi ulnaris. Okay, I know it's hard to remember because they're all sitting next to each other, but follow the tendon. Where's the tendon going? To the digits, say digitorum. To the ulnar side, say ulnaris. To the radial side, say radialis. Okay. Okay. And then we have muscles of the limb. We did this morning. All of this collectively, they are called quadriceps femoris, right? This one is rectus. This is rectus abdominis. Rectus femoris. And then you have your medialis. What's the first? That's right. Vastus medialis, vastus lateralis, and then if you take this out, vastus intermedius. Okay? Vastus intermedius. Next, okay, we're running out of seconds in the video. At the back, you have your hamstring right here, right? Give me a hamstring. Give me one of the back hamstrings. This morning. Short-term memory, guys.
Is there a femoris?
There is a femoris, yeah, that would be your biceps femoris. Femoris. This is your biceps femoris. It's on the lateral side. Okay, remember, this is the butt. We're looking at the left limb. This is the biceps femoris, and these are your semis.
Semimembranous.
Semitendinosus and semimembranous. Which one is which?
This is the one in the middle.
The membrane is the one inside, and the one with the longer tendon outside or more superficial is tendinosus. Okay, so again, biceps femoris, tendinosus. That's okay, we just did it this morning. Membranosus. Okay? How about we go laterally? What is this? No. That's right. What does TFL stand for? Tensor fascia lata. Okay. What about we go medially? What's this? It looks like a strand of grass. A blade of grass. Gracilis, that's right, gracilis. And then you have here your adductors. Okay, these are your adductors. Okay. We're missing one. I heard someone say sartorius, so we don't have the sartorius here, but this is the sartorius, which goes all the way here. Remember the sword, sartorius. And this is this looks like the iliopsoas. It's not. It's the pectineus. Not sure if that's on your list. They're just next to each other. Oh, down here. Okay. Gastrocnemius. If I take out the gastrocnemius, which I can't, but I'll just go on the side. That's right. Soleus, very good. You guys are ready. If you look at the gastrocnemius, the tendon inserts to the calcaneus. So the action would be plantar flexion. That's right. Very good. Yeah. So let's look at the anterior muscles right here. This would be your, what's this? It's next to the tibia and it's in front. Tibialis anterior. And it crosses the ankle joint, right? It crosses the ankle joint right here. So if this pulls up, what motion is that? Dorsiflexion. And then you have this. If you don't remember instantaneously, again, follow the muscle to the tendon. Where is it going? Digitorum again. Sorry, I almost said it there. Digitorum again. So is this a extensor or flexor digitorum? Extensor. Okay, it extends the toes. Okay, which means on the opposite side you have your flexor digitorum. Okay. What else is here? On this side you have your fibularis. Some books will label it peroneus. Okay, this is your fibularis, and if it pulls or if it shortens when it contracts, it moves the ankle this way or the foot this way. What was that? Eversion. That's right. That's eversion. Okay. We're gonna